Hello folks, my name is Mark. I'm a lab tech and I want to talk to you a little bit on how you know whether you're a really good clinical laboratory or not. We know or should know that in the urinalysis department, when you Kohler align the microscope correctly and the condenser is in the right position, the iris is about 3/4 closed, and that really can never change. And the reason why is that a Hyaline cast, which is very clinically significant for kidney failure, is only seen when the condenser is Kohler aligned and the iris is about 3/4 closed. It's a common mistake, sadly, because patient health is involved here. If you leave that iris open, the light blasts around that Hyaline cast, you'll never see it. Here's an image. You can see what the Hyaline cast looks like. So to avoid that impact on patient safety, is that most really good laboratories have a regular microscope to do the normal urinalysis, and they have a separate microscope with a phase contrast system. A phase contrast system is designed to look at objects that don't stain well, like Hyaline casts, or they're pretty much transparent, like Hyaline casts. And the phase system will always catch the Hyaline casts. And that's crucial for kidney failure. So it really shows you a really competent, laboratory that's up to speed and one that's really not. So go do that. Get yourself a urinalysis microscope with phase contrast settings. Thanks much. Have a great day.